Direct from 7 News headquarters, the latest on the coronavirus outbreak, with Michael Usher and Melissa Doyle.
Good evening and welcome. The emergency cash has begun flowing today and the infection rates are heading in the right direction. That's the good news.
But there are some worrying spikes and 4 babies have tested positive. We're also watching COVID clusters appearing in our cities. We will show you where they are and a surprising spread to some big regional areas. There are new powers to penalise anyone who doesn't stay home or keep their distance.
Who are the thousands of passengers still arriving at our airports every day? And the big question we're all asking, when might this end? Could it be sooner than 6 months?
But first to the curve, the total number of people confirmed to have COVID-19 stands at 4,559, rising by 310 new cases today.
Now, out of those, around 50 are currently in ICU. The death toll still sits at, it's sitting at 19. But overall, we're on the right track, according to the Health Minister Greg Hunt today.
Your actions are making a difference and saving lives. This progress is early, it's significant, but now with these additional rules around gatherings and movement, we are going the next step to help reduce again the level of infection and to support our containment.
And then taking a look around the state. So 114 additional cases were diagnosed in New South Wales today. Victoria rose by 96, Queensland jumped up by 55, and South Australia announced 32 new cases.
Now, clearly New South Wales is looking at a much sharper caseload. Let's look at a little closer at those numbers on this map here. The government released these, revealing where the majority of cases are. One of the concerns is the Hunter region. The government called on the city residents to cut all travel to regional areas, and the other major clusters are in backpacker areas such as Bondi and Waverley.
So for more on this, let's cross to Sydney reporter Amber Laidler. Amber, how are the restrictions being enforced across New South Wales?
Mel, New South Wales is now subject to what some authorities have referred to as the toughest social restrictions our country has ever seen. And despite the government refusing to officially call it a lockdown, that is essentially what it is. As of midnight last night, anyone who's caught leaving their home in New South Wales without a valid reason can be fined up to $11,000 or face up to 6 months in prison. Those acceptable reasons to leave the home include shopping for food and essentials, leaving for compassionate or medical grounds, or travelling to work or education if that can't be done at home. People can also be fined if they're caught gathering in groups of 2 or more. The exceptions there, of course, households where more than 2 people live, but also gatherings that are essential for work or education. In those instances, those strict social distancing guidelines apply. Here in New South Wales, we have seen police raiding parks and public spaces throughout the day, issuing warnings and infringement notices, and they say they will be upping their patrols to catch anyone who isn't following the rules, Mel.
All right, they're pretty tough, Amber. Thank you.
And there's new data out of Victoria showing the coronavirus hotspots there. Stonington Council area, one of Victoria's wealthiest suburbs, has been noted as an area of concern. The Mornington Peninsula has the state's second highest numbers. Another worrying development, 4 infants and several healthcare workers are on the list of the latest confirmed coronavirus cases. Let's cross to our reporter Estelle Greeping in Melbourne now. Estelle, hello to you. Now, some there have been already hit with some tough justice.
They certainly have, Michael. We've just had the first business here to be fined and caught out for breaching social distancing rules. That was China Bar in the suburb of Fitzroy. They've been fined $9,000 after 2 people attended the premises on Saturday night. Now, the manager says it was purely a social visit, but police were there within 10 minutes and they fined them for breaking the rules. In other developments today, 3 babies and a toddler are on the list of the latest confirmed coronavirus cases. The oldest of them is just a year old. Also, 6 healthcare workers from Box Hill Hospital in Melbourne's East have also tested positive to COVID-19. So the way things are going, it looks like Victoria's total number of cases could reach 1,000 very soon. Michael?
Right, Estelle Greeping in Melbourne, thank you.
And there are harsh penalties in other states. Queensland is issuing on-the-spot fines of $1,300 to individuals and over $6,000 to businesses defying the social distancing rules. In Western Australia, it's a $50,000 fine or 1 year in jail for those who breach quarantine. And from midnight tonight, hard border enforcement, meaning no one can move around the state unless considered an essential worker. South Australia has not yet opted to enforce the new two-person gathering laws. However, they are fining people in groups larger than 10.
There was a blunt message from the New South Wales police boss today to a number of cruise ships sitting offshore. It is time to go home, with all Australian ports now closed to the vessels. But there's perhaps a surprising number of international flights still arriving, bringing Australians home from overseas. When we checked the flight schedules this afternoon, 23 incoming planes are due from the UK, Canada, US, Middle East, Asia and New Zealand. Let's bring in travel expert James Wilkinson right now. James, thanks for joining the latest. You've crunched the numbers. How many passengers are expected to arrive in Australia?
Thanks, Michael. We're looking at some of the numbers at the moment. And to give you one example, usually there's some 3,000 seats every day between the United States and Australia. There's one flight operating still at United from San Fran to Sydney. It's just got 80 people on board. So we're seeing huge drops down. There's a British Airways flight leaving Heathrow tonight for Sydney with just 50 people on board. Normally that plane's a 300 capacity aircraft, as you know, every single day. So it is slowing down. Even Doyle to Sydney tonight's on 19 people. So people are obviously not coming back in the numbers of what we saw a few weeks ago, but the flights this week heading out of Australia on Qatar Airways alone are some 90% occupancy, load factor, and even 66 back to the US. So seeing a really sharp decline in people coming back to Australia at the moment.
It's surprising so many airlines are still flying though. How do passenger loads now compare to before the pandemic?
Well, even just in January, where we did see an impact, as you know, from China to Australia, that was an 83% load factor in January across the country. That was about 4.1 million people came to Australia. We're now running on average in about the 20s at the moment. Back in January, we had almost 60 airlines flying to Australia. There are 15 airlines flying to Australia this week. So really sharp declines there.
So which ones are those? Which airlines are still coming in and out of Australia?
Air New Zealand doing some trans-Tasman services at the moment. United's the only carrier to and from the US. Qatar Airways is the only Middle Eastern carrier. British Airways are servicing Australia up until about the 9th of April at this stage. They're servicing that. Cathay's 3 times a week. Singapore's 3 times a week. This is not per city. This is just to Sydney on a lot of these instances. So Singapore Airlines, usually 80 flights a week into Australia, just 3 into Sydney. But there are quite a few still coming in. LAN out of South America is doing 1 flight a week at the moment as well. So there are obviously quite a few ways for Aussies still to be able to get home. And Malaysia Airlines today just announced that they're going to be putting more flights back on in April and May to help Aussies get home. Yeah,
that's because the PM did tell Australians to get home from overseas a fortnight ago now. So how much longer will people have to get here? And will there be a cut-off point?
Well, a good point in case on this is United Airlines aren't going to cease services between Australia and San Francisco anytime soon. They're going to be flying that all the way through. A lot of airline schedules seem to come back online around mid-April. So airlines are preparing that if this thing does slow down, they can have people travelling again quite fast, whether it's to see family or for work. So at this point in time, we're seeing a bit of a slowdown from airlines, but quite a few actually have more flights coming back on, like Malaysia, like Singapore Airlines and others, through the middle of April onwards. Even Delta saying they might return by about mid-April as well. So the slowdown seems to be like it's almost hit its peak at the moment at the same time, but we'll see what happens there.
Keeping in mind the government's still saying there's a ban on Australians going overseas altogether. All right, James Wilkinson, thanks for joining us.
Thanks, Michael.
This as Australian Airlines are crying out for support. Now, Virgin is seeking a financial bailout from the government, and now Qantas wants to even the playing field. Let's bring in our network finance editor, Gemma Acton. Gemma, it's airline wars. Will both Virgin and Qantas receive the support they're asking for?
Well, Mel, so far only Virgin's confirmed that it's officially requesting around $1.4 billion worth of support. Qantas has simply said, look, if you give that to Virgin, we would expect something equivalent in order to play fair. And given that Qantas is quite a lot bigger, we could be talking around $4 billion. The government's made it really clear that it will support the airline industry. It's got to. It's obviously an incredibly important industry. Airlines was one of the first industries to receive any support at all with the $715 million package, which refunded some fees and charges. And then just last week, week we got an extra $300 million for regional airlines. So certainly if push comes to shove, and long before then actually, we will see the government helping airlines.
Yeah, and there's talks the government could then become a part owner of Virgin. So what would that mean for the business?
Yeah, it's most likely that initially the government would offer a loan to Virgin, and if Virgin wasn't able to fulfil the conditions of the loan, then possibly see the government move in and take a stake for taxpayers. This is quite similar to what we saw. The New Zealand government just offered a $900 million loan to Air New Zealand. One of the conditions of that is that they can't pay dividends as long as the loan facility is in use, so restrictions over how they spend their cash. It's really not unusual to see governments take big ownership stakes in airlines. If you look around the world, many governments actually own big majority stakes in airlines.
If the airlines don't receive this rescue package, will they survive?
Well, Mel, it really depends on how long coronavirus goes on for. If it finishes tomorrow, for instance, yes, the airlines will be fine. If it takes another year, then they could be in a lot of trouble. What we do know is that it is critically important for Australia. We're an island nation. We have a robust tourism industry under ordinary circumstances. Tourism is obviously going to be a vital part of our economic rebound that we're looking forward to on the other side of coronavirus. We do need at least 2 healthy, competitive airlines for that, so we can absolutely imagine that the government will be doing everything it can to help both these airlines survive.
All right, Gemma Acton, thank you.
Well, the first $750 handout has landed in the bank accounts of nearly 7 million Australians today. The tax-free payment was part of the first round of aid to help stimulate our economy, with many saying it's come just in time.
It's better than nothing. Yeah, just thank God for this help.
Probably keep me alive, not keep me going. Yeah, because I also have a daughter and I have a partner. Yeah, and I have to support them.
We also have to survive. You know, I understand we don't need to pay the rent maybe for 6 months or so. I understand about our employee, but to keep on going in this difficult situation, we are not earning any money. We don't have any savings.
And earlier I spoke with Government Services Minister Stuart Robert about who has received the money and where the government hopes it will go. Minister, are you confident that everyone who is entitled to this money has now received it?
I am. We've said all along that the 6.6 million Australians who receive the $750 will receive it between today and the 17th of April. The first 1.5 million Australians have started receiving it today, and we're hopeful that we can have 90% of it paid out this week, so 10 days earlier than we had first stated.
90% is a pretty good figure. What would you say the government would like to see Australians, I guess, spend it on?
Well, the Prime Minister has outlined the restrictions Australians are currently under and has emphasised that it's all about essentials. So I'd encourage all Australians, go to australia.gov.au or download the coronavirus app on the App Store or Google Play. All the information you'll need is there, but this money is there for essentials and to help Australians in terms of providing for those essentials.
Are you concerned that senior Australians who've taken a significant hit to their retirement funds might save this stimulus money rather than spending it?
Well, Treasury advice is that the money will be spent. And of course they've reached back to the GFC to look at trends in how people behaved. Different then, of course, because there was a lot greater freedom of movement. But again, would encourage all Australians. Get advice from australia.gov.au, get hold of the app, and spend it on essentials. All
right, so you're pretty confident it's flowing quickly, sticking to plan, about 10% of people to go to get theirs.
We're very confident we'll get these funds out this week, 10 days earlier, but we've given ourselves through to the 17th of April. So the key is Australians don't need to call us. The funds will flow through automatically to all primary payment holders because they're already part of our social security system. We know who they are and the funds will be moving quickly.
Stuart Robert, thanks for your time.
And there's been a surge in interest for the JobKeeper plan to help subsidise wages during this coronavirus pandemic. Just a day after it was announced, more than 192,000 businesses have registered their interest. For more on this, we're joined by the CEO of Business New South Wales, Stephen Cartwright. Stephen, good evening to you. Now, more than 192,000 businesses have signed up. How many more do you expect to register?
Well, the numbers are going up pretty quickly, Michael. I had a look at 4 o'clock this afternoon. It was over 270,000 companies that have registered. And when you think about the fact that there's about 1.4 million sole traders operating in Australia, I think you can comfortably expect the number to go above 1 million in terms of registered businesses seeking this sort of support.
So a day after it was announced, have you sort of really crunched it now, what the subsidy will really mean for businesses and their employees?
Yes, there's still a few grey areas, of course. There's some prior announced support, such as the 50% support for apprentices. We're still not quite sure how that interacts with this new support. But generally speaking, we're incredibly pleased that the government has made such a huge commitment to support businesses and jobs.
Yeah, look, another one of those grey areas too, for example, the workers who've been stood down have to come back to work to receive the fortnightly government payment. Is that correct?
It's not my understanding because by law, if you want to stand somebody down as an employer, you have to, first of all, prove that there's no work that can be done by them. So if they're being stood down because there's no work, I can't imagine that simply because there's a support payment available to them that suddenly the work materialises. So I would have thought that in many cases those workers will be at home but receiving their support payment, the JobKeeper money, if you like, via the employer's payroll rather than via Centrelink.
I had quite a few people reach out to me today on this point. And they're concerned, very concerned. What if an employer doesn't sign up to the JobKeeper scheme? What does that mean for employees who'd really like their job back and would like to get back to it?
So there's really no downside for an employer in signing up because the money comes in and then the money goes straight back out again to the staff member. So I would have thought the first thing that a worker should do is approach their employer, ask their employer to register so those payments can start to flow. But otherwise, the employee could contact the ATO and ask the ATO to contact the employer to get it set up.
But didn't the government say yesterday that the ATO is just going to go through the employer, not the employee, because it's not welfare, it's not a handout?
Yeah, that's exactly right. And that's why I think most employers will happily sign up because it's a way of supporting their staff and making sure they're still there when the good times come again. But in the event that an employer isn't aware of it and the employee doesn't seem to be able to explain it to the employer, then I would have thought that the employee could register and call up the ATO and say, look, I want to get access to this payment, but I need my employer to come along with me.
All right, we'll have to see what the government says about that. Stephen, thanks for joining us.
Thank you.
Well, let's go to Parliament House in Canberra as we talk about assistance. Political editor Mark Riley joins us. And Mark, residential rent relief, the government said that they would look into what could be done, but there may be a few issues.
Yeah, good evening, Mel. It's a very complicated area and there was a heads of agreement at the National Cabinet a couple of weeks ago, really, between the state leaders and territory leaders and Scott Morrison that the states and territories will go off and look at this area and come back with some proposals. What they've found looking into it is that it is intensely complicated. You have to first define what really constitutes the sort of financial distress that would qualify someone for rent relief residentially and also commercially. Well, commercially it's a little bit easier because many places have already shut their doors, many retailers have, but they're still being charged full rent and there's some anger rising in that sector about that. So something needs to happen there very quickly. But the notion of rent relief is simple, the answer is complicated. It may be that on Friday, the next National Cabinet meeting, there could be an agreement on commercial rent relief, but I'm told that the residential rent relief is more complicated and could take some more time. The banks have to come into play there because the landlords have investments and mortgages and would need relief if they're not getting any income, obviously, and might themselves have problems with their own income in their working lives. So there's a bit of a money go around. The JobKeeper allowance helps, $1,500 a fortnight for some tenants, but it won't really get you over the hump if you're in Sydney, for example, and paying big rents. So more work to be done on the residential side. Commercial, they might get there on Friday, Mel.
All right, complex but vital. The other one was a deal done today with private hospitals to make beds and staff available. How significant is that, both for the health industry and obviously the patients?
Yeah, look, very significant indeed. The private hospitals were facing a really tough time. Some of them had already laid off staff because the ban on elective surgery, which comes into force tonight, had caused as much as, well, almost a total collapse in patient numbers for them. So this keeps them operating and doing that under the public system for the time being. So that's 657 private hospitals remaining open with 30,000 beds. 105,000 hospital workers, and that includes 57,000 nurses and midwives, and a third of the hospital system's total ICU capacity. So big numbers, and you can see that would be vital for the hospital system as the virus spreads. And the conversions of the theatres and wards in the private hospitals could double the country's total ventilated ICU bed numbers from 2,200 to 4,400. But only 20 of them at the moment are occupied by COVID-19 cases, we were told at Greg Hunt's press conference today. That seems like very few, but we're still at the beginning of this, and so that could grow. And the cost of these measures, another $1.3 billion. On a normal day, that would be a massive announcement. These days, just another billion, Mel.
It's what it feels like, doesn't it? But thank goodness that they're able to make them all available. Thanks so much,
Very
Mark Riley.
significant.
Yeah, really appreciate it. Talk soon.
Pleasure.
Vital.
Extremely. There's no doubt about that. Well, still to come, home isolation. How much longer could it last? We ask a medical expert.
The government does a deal. We will talk more about this, the private hospital one, accessing all of those extra beds and staff.
Meanwhile, in New York, have a look at that. A field hospital's being built in Central Park as hospitals fill up.
And the good old-fashioned pen pal, how a group of primary school kids are connecting with the residents of their local nursing home. That is next on the latest from 7 News.
Tougher restrictions are now in place, but roughly how long will we be living under them?
Well, for more, let's bring in infectious disease physician Sanjaya Senanayakar. Sanjaya, thanks for joining us tonight. The big question, exactly, we've all been asking, what needs to be achieved before the restrictions can be safely lifted?
Yeah, hi Mel, that's a very good question. And we are seeing a drop in the number of cases, but it's too early to say if it's a sustained drop. And we know from the Chinese lockdown experience that it took about 3 to 4 weeks to see a drop in the number of daily cases. And given that we've brought in our most recent travel lockdown only recently, it would be at least a couple of weeks, I suspect, before we see anything like that.
Well, we've lost your light there, Sanjay. Just hold on one tick. We'll see if we can spark that back up again. I can see the cameraman racing in there now to change a battery. Our crews are working so hard out there at the moment. They really are. Anyway, we're back up. Let's check. Lights, action, camera, maybe. Lights still down. There we go.
Thanks.
Sanjay, finish your point there, my friend.
Yeah, no worries. So it might be about 2 to 4 weeks before we start to see that sustained drop. And once we've seen a sustained drop and low numbers of cases, the government might, in a graded manner, relax or de-escalate those measures. So maybe 1 week, let's open gyms, let's open beauty salons, and the next week, if there hasn't been a rise in cases, relax them further. But some things may not change. We will probably still work from home if we can work from home. We won't be shaking hands. We'll be social distancing. Those things are unlikely to change.
All right, Sanjaya, shine some light on this for me. Did you get it? I played with words there. What can we learn from the countries who are ahead of us here?
We can learn from Korea, for instance. They've done a number of good things, and we talked about it yesterday. Test. They've tested almost 400,000 people, 6,000 tests per million people, and they've been very successful. So we also, now that we're hopefully taking the overseas cases of COVID coming to Australia out of the picture, we might be able to expand our testing to the community to get a better idea of what's happening there. Also, what Korea did was ensure that the government had very frequent and good and trusting communication with the people, and they also use technology. So there is an app that the government has released, which I'd all encourage you to get, which has got a lot of useful information. China also was very successful, and that's because they ensured that people did observe social distancing, which I encourage all Australians to do.
Absolutely. I know that you've had a lot of people asking you why those with blood pressure issues are at a higher risk of getting coronavirus. What do we know about that?
Yeah, Mel, that's an unusual one, because we think of flu and other infections. We don't see blood pressure per se come up as a risk factor. And what's interesting is that the SARS-CoV-2, the COVID-19 virus, it attacks or uses ACE2 receptors in the body to get a foothold. Now, there are some medications for blood pressure called ACE inhibitors that also are associated with the ACE2 receptors. But it's important for people to realise, as of this moment, there is no evidence that the ACE inhibitor medications affects the outcome with COVID-19. But there is good evidence that ACE inhibitor medications, if they're stopped in someone who needs it for their heart, will lead to a bad outcome. So please keep taking it. And the other issue is hypertension may not even cause COVID-19. It may simply be that more older people than younger people have got hypertension, and more older people are having bad outcomes with COVID-19.
Sanjay, a bit of hygiene advice here. More Australians obviously are relying on food and groceries to be delivered to home. Any risk of spreading the virus from delivery services, or is it safer than going to the supermarket?
So technically there is a risk. The person who packs the groceries could contaminate whatever is being packed. The delivery person could also contaminate the groceries. But I would say that it is definitely safer than going to a shop, having to drive there, walk there, or use public transport, and then mix in a place where a lot of other people have been mixing and touching things that a lot of other people have touched.
All right, Sanjay, all good advice again. Thank you so much for joining us tonight. The world's most famous park turned field hospital, New York Central Park, is now home to more than 68 hospital beds, all housed in a series of tents, as you can see there. Built in just 2 days, the ER and morgue is entirely run by volunteers, and it isn't the only city landmark catering to COVID. The Navy hospital ship Comfort docked in New York Harbour, and that is bringing relief to the city's buckling health system on its deadliest day yet. 1/3 of Australia's intensive care capacity is in the private sector. Under that new deal with the government that we heard about today, the nation's 657 private hospitals, an extra 34,000 beds will be freed up to help tackle the coronavirus. Let's bring in intensive care specialist Dr. Bala Venkatesh at Brisbane's Wesley Hospital now. Thank you so much for joining us. Now, you've been treating COVID-19 patients in the ICU. Just explain for us, we'd be interested to hear, what are the difficulties treating patients with a new virus that's still so unknown?
Michael, that's a very important question. This is unprecedented. Till 3 months ago, we did not know about this virus. We did not know about this disease. And now we have this disease infecting more than 700,000 patients across 190 countries. So the scale of this is enormous. We do not have an effective antidote or an antiviral drug for this, nor do we have any drugs which can speed the recovery process. But that said, it's also it's important to recognize that in most patients, if they're infected, the symptoms are not there, or they have only a mild illness, and only a small proportion required to be in intensive care, and only a small proportion of that required to be on life support systems. So yes, the challenges are there, but in Australia we have a very good healthcare system, and we have a very good intensive care service, and we have excellent outcomes, and our outcomes consistently have been better than the rest of the world.
So intensive care beds, as we've heard today, are the important factor here, and a lot of resources are going in to make sure that the ICU beds are well supported, with more ventilators being made, with more specialist staff coming in. Are we prepared, though? We don't want to fall into the shortage of beds like we've seen overseas.
We have 191 intensive care units in the country. Two peak bodies, the Australia-New Zealand Intensive Care Society and the College of Intensive Care Medicine, have worked together to develop guidelines and also to assess the capacity. So we have the ANZICS, our Intensive Care Society, has released the capacity this morning and published in the Medical Journal of Australia. It's there in the public domain. We have 2,378 intensive care beds now, and we can surge by another 4,000. We have same number of ventilators, and we can surge by another 2,500 ventilators. So we have sufficient numbers of beds in intensive care and ventilators at this point of time. Now, as you know, we have only had about 45 to somewhere around 45 patients requiring intensive care so far, and that's about 1% of those patients who have been infected. So it's reassuring to note that the numbers are slowing down, the rate of new infections is slowing down, and the curve is possibly flattening, but it's very early days yet.
Very early days, because the government even today said, Dr. Bala, that the number of ventilators has to increase. In fact, there's a rush on to try and get more made. One company in Australia making 500 as we speak. Lots of innovation going on to getting the ventilators, because those machines have to more than double to cope with what is predicted to be potentially, a lot of ICU treatment. How important is that boost?
Oh, it's absolutely essential, and the government has created a task force to look into this. A number of industries are looking into this. They've been partnering with various hospitals and health groups and research organizations to develop new modalities. But what I want to assure all members of the public is that anyone who requires intensive care, whether they come to a private or a public hospital, will receive the highest level of ICU care that you can ever get in the world.
I think we realise that. We have a good system. Just tell me your personal experience in dealing with COVID-19 patients, and how is that from your point of view, and also the patient, the family's point of view as well?
I do not want to comment on specifics of which patients in which hospitals, but we are all trained to look after patients. We've had patients with suspect COVID-19 infection coming to the ICU, and we have looked after the patients and with successful outcomes. We've obviously had to work with families. It is an enormously stressful time for them to deal with this, and the staff are geared for providing support, the medical and the nursing staff, and we will continue to provide that service.
I guess I'm more interested, and I think our viewers would be interested to do, just as a condition though that we're still finding out so much about, up front and I guess very close with COVID-19, what is it like as a condition versus other conditions that you've had to treat?
We've, in intensive care, we get a range of life-threatening conditions, from serious infections, what we call sepsis, to patients having major surgery, trauma, burns, spinal injuries. We deal with a large range of conditions, and each condition has its own set of challenges. But with COVID-19, I think the biggest challenge has been the speed of transmissibility from one person to another. And I guess it's very, very new. We are still working on developing new antiviral agents for that. We are looking at developing a vaccine, they're all some time away. And I think the scale of it has obviously caused a lot of concern amongst people, amongst the public, amongst the healthcare professionals, whilst for other conditions over time, people have been able to research and discover new treatments, and we are working on that at the moment. There are research organizations in Australia, worldwide, and each private hospital and public hospital is doing that.
And we've covered a lot of that. All right, Dr. Bala, thank you so much for your time.
Thank you.
Still to come, the clinical trials around the world racing to find the vaccine, as the doctor referred to. Which ones are showing promise, and what you can do to help?
The extreme operation underway to sterilise the streets of Bali.
And it's a grim reality for so many businesses, as one restaurateur shares the heartbreak of farewelling his staff. That's next, here are the latest from 7 News.
Now, in laboratories around the world, the race is on to try and find a cure or a vaccine for COVID-19. Medical researchers are pursuing some 220 clinical trials involving over 3 million participants internationally. Dr. Manuri Gunawadena runs a website called Health Match, which is tracking all of those active trials and helping to find participants. Manuri, it's a lot to understand, so if you can sort of explain to us what's going on and which trials are showing promise?
Yeah, absolutely. Melissa, thanks for having me. So essentially, Health Match is currently tracking over 220 clinical trials globally. And it can be quite confusing. Every day we're seeing new clinical trials pop up and continue to pop up. The World Health Organization has said that there are 20 vaccines in development. But what we can really see as a trend is a bunch of drugs and vaccines that are being repurposed from existing treatments. So, for example, anti-malarial drugs, drugs that were used for the prevention and treatment of HIV, and medications that were developed for Ebola are now being repurposed and tested in the context of COVID-19. And we're also seeing new treatments and new vaccines being developed, which require rigorous testing to see how effective they are.
This is, I kind of feel like there's a bit of excitement in talking to you now about this, to know that so many are working on it. There's 20 potential vaccine studies going. How important is it that everybody around the world shares this information?
Incredibly important. I mean, we're facing what we could call one of the biggest health crises that we've faced in years, and everywhere globally is racing to find treatments. So it's super important to be able to know what is happening across the globe, both for researchers as well as the general public. I think having an idea of the tremendous efforts and work that medical researchers are putting into this fight against COVID gives people a bit of relief amongst all the anxiety.
A little bit of hope. And we're always so proud of our scientists here in Australia. They are working hard. There's several clinical trials underway. Can you tell us what they're focusing on?
Absolutely. So it's been an incredible week for Australia in clinical trials. We've seen 19 trial sites set up across Australia this week, and focusing mainly across two particular trials. One is the TB vaccine, which is now being repurposed and tested across 4,000 healthcare workers to see how effective that will be. And the other is the repurposing of a drug called chloroquine, which is an anti-malarial drug, and Kaletra, which was used in the treatment and prevention of HIV. So they're two of the promising studies that have already been set up and are starting to recruit patients.
Now, my next question then is, what can we do to help you? I understand that participants are needed.
Absolutely. So, I mean, one of the biggest issues that clinical trials face is finding the appropriate number of participants to make sure that studies are statistically significant and show the results that we want. Obviously, COVID has a lot of focus right now, but what we're calling out for the general public to do is that if you're a healthy participant or someone that's been diagnosed with COVID and want to help in clinical trials and accelerating these research studies, then jump on Health Match, sign up, and what we're aiming to do is connect any researchers that are running clinical trials with these patients and help in whatever way we can.
I think everybody wants to help in whatever way we can. It's wonderful to hear that so much is going on. Manuri, thank you for joining us.
That is absolutely fascinating, isn't it? 19 trial sites and using a TB vaccine as well.
And I love it that they're all talking all around the world. What have you got? What have you found? What works? I think that's the way we're going to crack it.
Good. All right, Mel, thank you. Still to come, breaking news from a Sydney raid on a backpackers. We've got that shortly. Also, Indonesia shuts its doors to foreigners.
And it's paying too many businesses no. The restaurant forced to shut its doors and farewell its staff after nearly 40 years. That is next on the latest from 7 News.
Let's go straight to some breaking news out of Sydney tonight. Police have raided a backpackers hostel over a rooftop gathering. They promised they were going to get tough. Let's bring in reporter Serena Andalora, who's live at the scene. So, Serena, hello. What's happening there?
Well, Michael, earlier this evening we brought you pictures of backpackers packing onto the rooftop of a King's Cross a hostel here. It came after a tip-off from a very concerned resident who saw the behaviour and was concerned that it could be a potential spreading situation of COVID-19. Now, we can tell you police have just entered the hostel. They have gone up and broken the party up and had some stern words to say to these people. No social distancing respected here, but it's all part of course, a coronavirus crackdown right across the city. Police moving in to disperse crowds at parks at Coogee and at Rushcutters Bay, issuing fines and infringements after last night new laws were passed, very strict laws. This kind of behaviour now attracts quite hefty fines and even jail time. Now, they are also concerned about a dramatic rise in cases in the eastern suburbs here. Bondi has shaped up to be a particular hotspot.
All right, Serena and Laura in Sydney, thank you for that. They're lucky they got stern words and not fines, given what the government's promised. All right, Serena, thank you.
Not even the nation's most iconic tourist hotspots are safe from the financial fallout of the virus. In Sydney's once buzzing Circular Quay, the owner of a 24-hour restaurant is facing the heartbreak now familiar to so many small business owners, saying goodbye to his staff who, after nearly 4 decades, have become like family.
It's quite devastating to see the effects the virus and the shutdowns had on Circular Quay. As I look out there, I'm looking at empty ferries, empty concourse, just groups of pigeons standing around wondering where they're going to get a meal from. It's quite shocking. No tourists, no locals, lights are turned off. It's just devastating. My name's Stephen Duff. I started this restaurant in 1987. This is a 24-hour, 320-seat restaurant. It's always been very active all the time, and I'm sure most people in Sydney have been here before. We employ up to 100 staff at a time. We were required to close our doors at midday on the 23rd and had to stand down all the staff. Some of them have worked with us for up to 30 years, so you know their families. Some of them are just about to have families. Not only are we setting off people, but their spouses are being stood down. At the moment I've got 3 people we sponsor who have got no support whatsoever from the government, 50 or more casuals, people that just live from week to week that are paying their rents. We gave them all the food from the restaurant when we closed down, but obviously that'll only last a few days. They're all people that aren't the sort of people that sit around at home, they're the people that actually want to work hard, and these are the sort of people that have often got 2 jobs that do whatever it takes to pay the bills. They don't ask for anything. I really don't know what's going to happen if this goes on for month after month after month. I'm sure we'll get through this crisis, but the big thing for me is to be able to keep our staff. It's the staff that make the business, not the other way around. So it's in my interest to keep every individual, keep them positive, make sure they've got food and can pay their rent, and at the same time keep the business in a viable situation so it's here when they get back.
We're learning tonight that Indonesia is the latest country to close its borders to foreigners. Authorities are stepping up efforts to contain the spread of the coronavirus, which has already infected more than 1,400 people and killed 122. Squads of volunteers have been employed to help authorities increase awareness about the pandemic in thousands of the country's much smaller villages. Well, still to come, the primary school pen pals writing letters of love to their local care homes.
My favourite colour is green, I'd say that. Always be happy. Love from Ida.
It's a beautiful story, and it's next here on the latest from 7 News.
Now, I love this. When the pupils at a primary school in Melbourne heard about a local aged care home that could no longer accept visitors, they decided to do something about it. They started a pen pal program, writing letters and drawing pictures for the residents of Bupa Aged Care in Edith Vale to cheer them up while in isolation.
Hi, my name is Iris. I love hanging out with my friends. My favourite food is pizza with cheese.
How does that make you feel, John?
Oh, no, that'll do.
I'm in grade 3 and I like to watch rugby and footy.
You are kind, you are the best, I love you, you are special.
Well, we are joined by Lexi Dennis, the General Manager of that care home. Lexi, good evening. Look, I know it's been pretty tough for everyone, but how are all your residents managing, particularly when they were told no visitors?
Yeah, look, it is pretty tough. It's really, unfortunate at these times that we have to close the doors to visitors, but we're trying to keep our spirits up as best we can.
Now, we love this. I'm sure this is doing it big time. How did the pen pal scheme come about?
So we were looking at different ways and how we can connect with the community. And when this idea came about, we thought, wow, we have to do this. So we installed a letterbox at the front of our home and put the word out to try and get some connections with the community. And we were lucky enough to make friends with a local primary school, and we got a bunch of letters from the kids, and it's just been wonderful.
Are there different ages? I'm sure the kids are some of them are little, some are bigger. What are some of the letters they do, and how much do the residents just love getting them?
Yeah, look, it's been wonderful. You know, we've had lots of letters, a lot of pictures, a lot of drawings, really, you know, colourful, bright, vibrant pictures and drawings that the residents, when we opened them up, you know, we saw so much brightness and love and kindness, and we're reading about the stories about these kids and, you know, what they like to do and their favourite food. And it's just, a lot of fun, and the staff have really enjoyed reading the letters as well. We've been able to, you know, really brighten our days when we really needed it.
So there would be other, I guess, there'd be other schools watching. There would be other aged care facilities watching this. What would you say to them to encourage them to do this, to participate? What would they get out of it?
Yeah, look, I think, you know, it's a wonderful opportunity to really, you know, build some connections in the local community that perhaps weren't there before. I mean, in normal circumstances, we would have volunteers, we have student groups or kinder programs coming through our home. But, you know, in the times that we're seeing at the moment, it's a wonderful opportunity to make a connection with a local school and you know, bring a bit of joy into our residents who, you know, are really missing their visitors. So I think it's wonderful, and the more we can do it, the better.
Absolutely. Lexi, it's fabulous. All the best to all the kids doing it, to all the residents getting their letters, and thanks for telling us about it.
Thank you.
Don't you love it?
No worries, my pleasure.
Oh, I thought that was awesome. Such a good idea, because the kids are disconnected from family as well, so it's a really nice thing
so
to do.
hopefully some other schools might do the same.
Yeah, good story there. Now, your Wednesday weather forecast is next here on the latest from 7 News. Back in a minute. Welcome back. We're going to take a live shot now of London and the famous London Eye, where there are blue skies. Doesn't that look fantastic there today? It's a crisp 7 degrees, we're told. Let's leave the shot up, have a look at the temps around our country. 29 in Brizzy, Canberra 25 and partly cloudy, Melbourne 24 with some possible showers.
And in other parts of the country, Bowen 31 and mostly sunny, Narrabri a top of 30 and 38 in Karratha today.
Well, thank you once again for your company this evening. From the team here at 7 News, that is the latest. I'm Michael Usher.
And I'm Melissa Doyle. Good night.